Hi, I'm Sophie, and today I'm going to be talking about the chemistry behind chemotherapy. The reason that I wanted to do this topic is because, number one, I have had several family members and loved ones in my life who have had to go through chemotherapy, and I know that a lot of other people can probably say the same. And also, I am a nursing major, so I thought that this could be something that I could come across in my career and throughout my job. So, a couple things I'm going to talk about are what is chemotherapy, what is cancer, the different types of chemotherapy, roles of different types of experts in different fields that all work together to make chemotherapy happen, and how does chemotherapy affect society. So I'm going to start off by talking about cancer. Cancer is defined as a disease caused by an uncontrolled division of abnormal cells in the body. So at the cellular level, cancer is cells having issues with DNA replication. It pretty much means that they are replicating way too fast and the process just can't keep up and the cells just keep on dividing. So as you can see from the picture that I provided here, you can see that the normal cells are a nice circular shape, and then if you look at the cancer cells, they are very different looking. They look a little messy, they're jagged, and then you can also see that they have several nucleoli, which means that they are dividing way too fast and the body won't be able to keep up, and that will cause cancer. A couple things that can cause cancer that can be linked to personal choices would be things like genetics, smoking, diet, and exposure to harmful substances, which could be things like carcinogens, which are just cancer-causing substances that are in many different things, or things like UV rays. Those can also cause cancer. I just wanted to include a couple facts about cancer here. The most popular cancer, the most common cancer in America, I should say, is breast cancer, followed by lung cancer, then prostate, colorectal, and melanoma, and I included this little graphic on the side just so you can see a little pie chart image of the different types of cancer and how common they are in Americans. Okay, according to the National Institutes of Health, a few different treatments of cancer are radiotherapy, surgery, and systemic therapies. These include things like immunotherapy, which helps people to boost their immune system, hormonal therapy. These are done in either testosterone for men or estrogen in women, and they are just, these types of therapies can just manipulate those different hormones, and they can help the cells to divide normally. And then chemotherapy is what I'm going to be talking about today. So, to introduce chemotherapy to you, it is the treatment of disease using chemical substances. It kills fast-growing cells and stops them from metastasizing, which means it stops the cancer from being spread to different parts of the body. And chemotherapy drugs can be taken by mouth or by injection. So they can either come as a drug, like a liquid medicine that you would take from a cup, or an injection, which would just be like a shot into the tumor. A couple other uses for chemotherapy other than just to kill cancer in the moment, according to the American Association for Cancer Research, chemotherapy can also kill hidden cancer cells after treatment. So if there are leftover cells in the body, the drugs from chemotherapy do stay in the body for a little while, so they can keep on killing more cells that might show up or that might have been left over. They also prepare the body for other types of treatment. This is really interesting because since chemotherapy is a very strong drug and is a very intense treatment to go under, it can help your body get prepared for a lot of other different types of treatments like radiotherapy or like the immunotherapy or hormonotherapy that I had talked about earlier. And then also chemotherapy eases signs and symptoms of cancer as well. Here's just a little timeline of chemotherapy development. In the early 20th century, chemotherapy was developed, and it was not originally supposed to be a cancer treatment. which is very interesting. It was actually used during World War I to try to understand why people had different white blood cell counts after they were exposed to nitrogen mustard. So that's an interesting fact. In 1943, it was officially discovered as a treatment for cancer, and then in 1946, two doctors named Dr. Roy Hertz and Dr. Min-C Lee, they actually published and finalized that chemotherapy could be used to treat cancer, and they are two pharmacologists from Yale University. This is all information that I found from Vincent DeVita, and he wrote an article about a history of cancer chemotherapy for American Association for Cancer Research. Here's just a little picture. This is Dr. Min-C Lee. He's on the right side, and Dr. Roy Hertz is on the left side, and they are just the two pharmacologists who helped develop chemo. Here I wanted to include a few different types of chemotherapy so that you can see that there are several different types. It just depends on what kind of cancer you have, and it can also depend on the individual patient's body and how they react to different drugs. So just to reiterate, chemo drugs can be taken either by mouth injection or by being placed directly into a tumor. And then here are some different types of chemotherapy drugs. First is alkylating agents. These are used for leukemia, lymphoma, breast, lung, and brain cancer. And underneath I included a few different types of drugs, and you can also see their chemical makeup so you can kind of understand how chemistry fits into chemotherapy. So you can see an alkylating agent, busulfan, has a chemical formula of C6H14O6S2, and this is just one of the many different types of drugs that chemists have developed to use for chemotherapy. Next is antimetabolites. These are used for leukemia, breast, ovarian, and intestinal cancer. Anti-tumor antibiotics. These are just antibiotics that can help to shrink tumors and can also help them they can keep them from growing. These are used for many different types of cancer. Topoismurase inhibitors. So topoismurase is a enzyme that is used in DNA replication, and so the inhibitors can help stop them from replicating so that the cells don't divide too much. These are used for lung, ovarian, gastrointestinal, and other cancers. And then mitotic inhibitors, these just stop cells from undergoing mitosis so that for the same thing, so that they will stop dividing so quickly. These are used for myeloma, lymphoma, leukemia, breast, and lung cancer, and these are all facts that I found from Medline Plus. Some different roles of chemists and biochemists. So chemists refine enzymes and bacteria of drugs. So they take drugs that they find in nature, and they can actually go into the lab and refine the drugs at the bacterial level to make them perfect for use for chemotherapy treatment. Synthetic and medicinal chemists, they make the drugs, so they actually produce them, package them, and send them to the hospitals. The term chemotherapy was coined by a bacteriologist, and medical oncologists administer chemotherapy. So they are the doctors that will be in the room that will actually give the drugs to the patients. And this is all information that I found from David Juckett from the Chemotherapy Chemistry Encyclopedia. These are just some images of different chemistry and biochemistry professionals. They are just working with different patients. It just shows kind of what they do. Here in this image, we have a doctor who is talking to a patient, just trying to help her to stay positive. Here we have a doctor who is administering chemo to this patient, and here we just have another doctor who is supporting this patient through the chemotherapy process. Some other experts who work with chemotherapy are statisticians. These people, they study numbers, they take data from research, and they can just see how efficient and how effective different chemotherapy drugs are by using math. Nanotechnology experts, they create the equipment that is used to administer chemotherapy, so things like IV bags, different kinds of syringes, and everything that will be used to inject chemotherapy. Chemical engineers, they use process and device design, so they help to improve how the chemotherapy is administered to the patient. And then government agencies help with funding of chemotherapy. Because chemotherapy can be very expensive, the government helps to make it more affordable to more people so that more people can be treated. This is also information from the Chemotherapy Chemistry Encyclopedia. Some societal impacts of chemotherapy. So I included some positive impacts here and some negative here because we always have both. Positive impacts. Chemotherapy saves hundreds of thousands of lives, and these are people who are family members of people, friends, loved ones. It also improves quality of life. So like I talked about, chemotherapy eases signs and symptoms of cancer for patients who do have cancer, and it can improve their quality of life by a lot and just make it so much more livable. And then it can also cure other diseases through the process. So I have an example here is that my grandma recently went through chemotherapy for breast cancer, and she had psoriasis. And then at the end of her chemotherapy treatment, she didn't have psoriasis anymore, and they said that it was actually the chemotherapy drug that had made it go away. So that is interesting. For negative, the treatments can be toxic to the body. It doesn't mean that they will kill the patients, but chemotherapy can make patients sick. And also there are a couple side effects such as hair loss, fatigue, and anemia. These things do come with chemotherapy, but I think that the good of saving lives from cancer definitely outweighs the bad. And then this is all information from the American Cancer Society. According to Jamie Reno from Chemotherapy Future, here are a few different things that are going to happen in the future with chemotherapy. So there is going to be new nanotechnology created to reduce pain. This just means that there will be some improvements in the actual equipment that is used to deliver chemotherapy drugs to make it easier for cancer patients to relax and just have a painless process. There will also be advancements in enzyme refinement, which just means that they will work harder and harder to perfect the drugs that are used in chemotherapy to make them perfect and help them to attack cancer just exactly the way that they want them to. We will be moving towards less adverse effects with chemotherapy, which just means that they are going to continue to study the side effects of chemotherapy and see everything that they can do to help eliminate those side effects and to make it a healthy and painless process for cancer patients. And then they're also going to be using combination therapy more, which just means that they will include different types of chemotherapy and different other types of cancer treatment together. So those will be things like radiotherapy, immunotherapy, and hormonotherapy, which are things that I talked about earlier. They're just going to be combining different things like that together to work with each other and to help it cure cancer faster and more effectively and more efficiently. So in conclusion, chemistry is at the core of chemotherapy, and without chemistry, chemotherapy would not be possible. The drugs would not be able to be made. Chemotherapy is produced by chemists and biochemists, so there's just no way that it could be possible without chemistry and without biochemistry. And then here are my references. Thank you.